To get through. Next up is Frizell here.
Good afternoon. My name is Frizell. I have Parkinson's disease and I'm a medicinal cannabis patient. I apologise in advance for my voice. It's a symptom of Parkinson's. I'm hoping it'll hold out for the next 2 or 3 minutes. Difficulty swallowing. Dyskinesia, which is uncontrollable, involuntary movement, much like a violent tic. Depression, anxiety, nausea, blurred vision. Mental confusion, delusions, hallucinations. Increased tremor, irregular heartbeat, obsessive and compulsive behaviour. These are just a few of the many side effects of the common medications that are used to treat Parkinson's disease. As if the symptoms of the condition itself aren't frightening enough. Neurologists are keen to prescribe a veritable cocktail of chemicals, and I've tried a selection of different drugs, none of which had any positive effect on my symptoms, and all of which made me feel very ill. Truth be told, if I've read through the long list of possible side effects, and I very much doubt that I would have even tried them. Cannabis saved my life because I'd reached the end of my rope. My tremor had become so severe that I was having difficulty in feeding myself. My quality of life was virtually nil. I remember the first time that I tried using cannabis. I'd read accounts online from people with Parkinson's who were successfully treating themselves with cannabis, and I hardly dared hope for the same results. But the effects were dramatic. I went from being a shaking wreck to almost complete calm within 10 minutes. Dystonia in my feet was improved, my anxiety was alleviated, I found it easier to speak and my voice was stronger. Cannabis gave me back a semblance of normality. I still had Parkinson's, but cannabis made life bearable. There's little doubt in my mind that I would have taken my own life had it not been for cannabis. And I feel some anger at the healthcare professionals who subsequently admitted that they knew it could be beneficial for some patients, but neglected to mention it even when they saw how distressed symptoms of Parkinson's were making me. They were apparently happy to prescribe medications that made me ill, and even offered to prescribe me other medications to help me to tolerate the side effects of those meds. Cannabis has some side effects too. Sometimes an increased appetite, sometimes a dry mouth, but nothing compared to those of the traditionally prescribed medicines. I've now had Parkinson's brain surgery to control my tremor, and this does a fair job of masking my symptoms. But I still use cannabis most days to calm my tremor as it emerges, to control my anxiety, to help me get to sleep. I do not take any other Parkinson's medications. I and many other people with Parkinson's who could benefit from cannabis want to be able to do so without making a criminal of myself. Thank you very much for listening.